Afternoon, everyone. My name is Brittany Sandage, and I am here at the Drug-Free Action Alliance headquarters in Columbus, Ohio. And before we get started with today's webinar, just a few housekeeping items. I will be here to monitor all of your questions or any troubleshooting issues you're having with audio or visuals. So please just make sure to use your chat or question box in your dashboard to the right. As we move through this today, please be mindful that we will take as many questions as we can and answer those towards the end of the webinar, but this will be recorded and you will be able to access the link in a follow-up email you'll receive with your certificate for participation, and we will post that to our YouTube channel at Drug-Free Action Alliance. So without any further ado, I'd like to go ahead and turn the mic over to our guest presenter today, to Cindy Clouner with the Ohio College Initiative, and with that we will get started.
Hi everyone, it's Cindy Clouner here, a Program Manager for the Ohio College Initiative with Drug-Free Action Alliance and Prevention Specialist with the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery at Ohio State University. And thank you so much for joining us for our webinar today. And so we just want to talk a little bit about kind of where we're at with the Ohio College Initiative and where we're going, and then we'll dive right in with our topic today, Environmental Prevention 101, moving upstream. So the Ohio College Initiative, we're really excited this year. It is celebrating our 20th anniversary, and historically it's been really focused on training and supporting campus professionals and community members on environmental prevention and supporting the development and sustainability of coalitions, both community and campus focused coalitions. And so with it being our 20th anniversary, we are really focused on getting back to the foundation of the Ohio College Initiative and what it was all about, and supporting our campuses as they work to address environmental factors that might influence high-risk alcohol use, substance misuse. And with that, we have a webinar series this year, and this is the first one of that series. So we really just want to set kind of a foundation for what environmental prevention is today. It's going to be kind of very high level and looking at when we talk about environmental prevention, what is it that we mean? And we hope that over the course of the series we'll kind of dive in a little bit deeper and allow you to learn more about specific tools that can help support those efforts as we go along. So it seems like our webinar session is titled Moving Upstream because that's really what environmental prevention is all about. And those of you who have been in the prevention field for a while may be familiar with our prevention parable, which kind of illustrates why we want to move upstream. So the whole story starts with a man and a woman fishing downstream in a river, and they start to see a person in the river that needs rescued. So they rescue this person, and they go about their day. And as the day goes on, more people come down the river that need rescued, and eventually they get tired of doing this rescuing, and they say, well, why do they need rescued to begin with? So they go upstream to take a look and see what it is that is causing all of these people to need to be rescued out of the river. And when they go upstream, they find that people are really drawn to the edge of the river, but there's no really safe way to look at the river from the top. And so the fishermen go to the community leaders and report the number of people that have fallen into the river, and they realize that it's because there isn't a protective barrier at the top of the cliff to keep people from falling over. And so with that, they build a wall so that people can safely view the water. Some might still fall over, but the majority of people are able to view the river safely without falling in. So by moving our focus upstream and by putting in protective barriers there, we're able to reduce the number of people who need intervention later on. And so that's really what environmental prevention is all about. And today we're going to take a look at kind of some of the research around environmental prevention and why it is so important. And we're going to start with the public health model because it really gives us an idea of why environmental prevention should be a focus. So when we talk about people developing addiction or other diseases, because the public health model translates to all public health issues, it's an interaction between the host, the agent, and the environment. So when we talk about the host is the who, the agent is the what, and the environment is the where. So when we apply this to collegiate alcohol misuse, Our what would be alcohol, or if we expand that, we can look at, it can be drugs as well. Our the host is our college students, and the where, the environment, is the environment that they're in, and that could be our physical environment, it could be our social environment, it can also be our cultural environment. And so environment is really important when it comes to prevention efforts, because we could spend hours building a snowman and make it look really, really great, but if you put that snowman in the desert, it's eventually going to melt. And so the same is true when it comes to people. If people can have all the skills, the knowledge, and the attitudes they need to be successful and live healthy lives, but if they're in an environment that doesn't support those same choices, it's going to be significantly harder for them to make them. So if we want people to succeed and be healthy, we want to ensure that the environment they live in supports those efforts as well. And so that's why it's so important that we have environmental prevention. And when we say environmental prevention, we're defining that as prevention strategies that are aimed at changing or influencing community conditions, standards, institutions, structures, systems, and policies. And like I mentioned before, the environment can be a lot of different things. So we can be talking about the physical environment, like the number of alcohol establishments a community might have. We can be talking about the social environment, which is the attitudes and behaviors of the people that are around them. It can also be the cultural environment, so the cultural norms around what is considered acceptable use. So the idea is that if we can change the environment to support low-risk alcohol use, we'll reduce the number of alcohol-related problems that people experience. So one of the things that helps us illustrate the importance of environmental prevention is the prevention paradox. And national survey data shows that the bulk of drinking-related harms reported by college students actually happen to drinkers who consume at non-extreme levels. And the groups, that would be the groups that most people would consider not to be high risk. And while a given individual's risk for experiencing harms increases with consumption, most drinkers do not consume extreme amounts of alcohol. These extreme heaviest drinkers are at a greatest risk for alcohol-related problems. However, because there are so few of them, they generate proportionately small amounts of all of the drinking harms. However, the risk for alcohol-related problems isn't zero, even among those who are drinking at a low-risk level, and there can be secondary problems for those that are considered non-drinkers. And because low-level drinkers are much more numerous, that middle section, there's so many more of them, they actually end up accounting for the majority of the harms. And so this is what we consider the prevention paradox. The prevention paradox for prevention strategies suggests that we moderate consumption among the majority, and we can do that using environmental approaches, which may result in substantial benefits to the community, but relatively small gains to specific individuals. So the goal of environmental prevention is to push the average to the left. So if you see our bell curve, the number of drinks are at the bottom. We want to move the average of the number of drinks people consume to the left so that the average is less than where it is now. And in terms of alcohol, we want to reduce those number of drinks so that we reduce problems. And we see that the research supports that as well. So when we see an increase in alcohol availability, we see an increase in alcohol consumption, and we see an increase in alcohol-related problems. And this is also true for drugs. We see the same patterns. So when we talk about prevention, we usually talk about two different kinds of categories of strategies, individual and environmental, and we're focusing on environmental, but I want to highlight some of the differences between the two. So individual level strategies are really focused on behavior and behavior change, where environmental prevention is focused on policy and policy change. Relationships between individuals and their alcohol-related problems are one of the focuses with the individual, where we're looking at social, political, and related problems when it comes to environmental strategies. Environmental strategies tend to be more long-term, so when we make those changes, they last longer, they occasionally take longer to make happen as well. And with individual strategies, the individual is the audience. They're receiving that, versus environmental strategy, the individual is the advocate. So it's an opportunity to empower those around us to make change for their environment. In individual environments, we're looking at changing the knowledge, attitudes, beliefs, and behaviors of people. And we use lots of resources that focus on one individual to make those changes. and that differs from our approaches with environmental prevention strategies. So in a shared environment, we want to focus on the norms of that environment, the availability and access, as well as the policies and the enforcement in that environment. And all three of those things, by focusing on them, we have the ability to impact change for everyone that lives in that environment, in that community, versus just the one person. So that's one of the highlights, I think, for environmental prevention, is that it doesn't take as much resources to make those changes compared to if we're only trying to affect change at an individual level. And we know how busy those of you that are working on a campus are. You're very stretched for resources. And this is something that environmental strategies are things that people can do even if they don't have specialized training in prevention, health promotion, or addiction. So it's an opportunity to get involvement from other people and have them help you do the work. So we're going to kind of dive in now and get an idea of the different kinds of strategies that we can take when we are looking at making change in our environment and how we can go about doing that. So the first area is norms, and norms are the rules that people have that guide what is considered acceptable, and that might be in terms of behaviors and values, as well as in beliefs. And when we talk about norms, we usually talk about two different kinds of norms. There's injunctive norms, which are what people perceive as being approved of by others, and there's descriptive norms, which is the perceptions of how others are behaving. So injunctive norms are what things ought to be. So for example, whether a peer group condones drinking 5 or more drinks in one setting, versus descriptive norms, which is the perception of what actually is happening. So the perception of the number of people who actually do drink 5 or more drinks in one setting. And whether or not people approve of that norm doesn't really matter. The other thing that's important to remember with norms is perception is reality. So whatever people think is happening might as well be happening. And so oftentimes students drastically overestimate the number of people who are engaging in high-risk behaviors like drinking, especially drug use. So we see that a lot. Those of you who are taking surveys like the ACHA or core surveys to gather data probably see the difference between the perception of marijuana use and other illicit drug use compared to the number of students on your campus who are actually using those substances. So when we talk about norms, well, how can we address those? There's a couple of different strategies, and on college campuses, using a social norms campaign is really popular and can be effective, especially when it's paired with other strategies. And I think that's true for all of the strategies that we talk about today. There isn't one magic silver bullet. It's a combination of lots of things. And for social norms, that's even more important. But social norms campaigns rely on local data to be the most effective. So to be able to implement a social norms campaign, it's really important that you have that baseline data from the NCHA, the National College Health Assessment, the core survey, or from your own survey that maybe you've developed in-house on your campus to be able to implement a social norms campaign. The most effective messaging challenges those descriptive norms or the perceptions of behavior that people have. They also avoid using scare tactics. They're really focused on what the truth in terms of the behavior is for students, rather than focusing on what would necessarily be considered right or wrong behavior or how a person should behave. It focuses on the healthy choices of the majority. So we have a few examples here of some campuses and the social norming campaigns that they have done. So the Social Norms Center, the National Social Norms Center, which is now at Michigan State University, is really an excellent resource when it comes to social norms campaigns. And one of the things that you'll be receiving at the end of the webinar, along with in your evaluation email, is a link to our Dropbox folder, which has a number of resources in it for you to refer back to, including the link to the National Social Norms Center. So if you're interested in looking at social norms campaigns, they're a great resource for you. But this is kind of the logic of a social norms intervention, and I really want to bring attention to the desired impact. And you'll see it's harm reduction. So our whole focus for social norms is to reduce alcohol-related consequences. Social norms campaigns aren't intended to stop drinking behaviors altogether. It's to lead to harm reduction. And so it's really important that social norms campaigns are paired with other interventions as well. Another great example of shifting norms is the use of media. The drunk driving example is probably one of the most standout examples that we have. So in 1983, the Ad Council published a mass media campaign, Friends Don't Let Friends Drive Drunk, and I'm sure all of you are very familiar, at least with the slogan, even if you don't recall seeing some of the advertisements, because now it's a slogan that everyone is aware of. And after launching in 1983, they saw drinking and driving rates drop dramatically over that time and eventually hit an all-time low in 1998. And during that time, 70% of Americans had said that they tried to stop someone from drinking and driving. So the campaign was really effective in not only reducing drunk driving, but also increasing awareness around the issue and empowering people to stop their friends from driving drunk. In 1998, though, they had their all-time low, and then they started to see a slight increase in the number of people who were drinking and driving. And I think that's another good example of the importance of keeping a message fresh and relevant, because what they found was that there were a number of people who didn't resonate with the message about driving drunk because they would only have a couple of drinks and would drive, and they didn't consider themselves to be drunk. And so the Ad Council modified their campaign to the Buzz Driving campaign. And so now you can see an example of their Buzz Driving campaign, and they likened it to drunk driving to get people to realize that buzz driving is drunk driving. And so their Buzz Driving campaign has allowed the drinking and driving rate to come down again. And in 2013, 49% of adults who are over 21 said that they will always get a ride, take a cab, or use public transportation rather than drive if they feel buzzed. And that's a 7% improvement from when they launched in 2005. And so now the message is drive sober or get pulled over. But we've consistently seen a message around drinking and driving, and it's evolved over time to meet the needs of people. So the next area is availability and access. And availability and access is all about how much effort or money it might take to get something. Because the more money and effort, more time, more energy it takes to get something, the less likely a person is to obtain it. So when we're talking about alcohol, or primarily, but with alcohol, the number of outlets, so the number of retail stores or bars or restaurants that are serving alcohol that are accessible to people, the more they are, the higher rates of drinking we see. The proximity of alcohol and other drugs to people, so if people have access to them, if we're on a college campus and right across the street from the residence halls is a whole line of bars, that's really close proximity, so it makes it really available, really accessible. Cost is another piece of availability and access, and that's something that we can use policy to adjust, as well as proper storage. So that can be, especially if we're talking about underage groups, it can be making sure that alcohol is stored in a way that isn't accessible, but this probably applies more to things like prescription medications, making sure those are stored so that they aren't available and accessible to people. And I think the marijuana issue is a great example of what availability and access can do in terms of consumption of marijuana. So this map is using National Surveys on Drug Use and Health data from 2013 and 2014. And the blue states have a lower rate of use. The red states have a higher rate of use. And this is looking at 12 to 17-year-olds rather than our college population, although I would venture to guess that our college population, the colors of our states would probably be pretty similar. So one of the things that jumped out at me at first, and maybe has jumped out at you, is when we look at those states who have legalized marijuana for both medical and recreational purposes, all of those states, Colorado, Washington, Oregon, Alaska, Washington, D.C., are all in that dark red, so have the highest rate of marijuana use among their 12 to 17-year-olds. And even when we look at the states who have legalized marijuana use for medicinal purposes, there's 25 of them currently, and the only states that have legalized marijuana for medicinal use that are not red are Illinois, Hawaii, Pennsylvania, Tennessee, and Texas. And Texas has only legalized it for epilepsy. So 5 out of that 25 are somewhere less than those red states. So I think it's pretty clear that what we're seeing is the availability and access and increasing that has increased consumption of marijuana among our youth. We're seeing that with our college students as well. So how can we address availability and access? Well, there's a lot of different options. A few of these are listed here. So restrictions on hours of alcohol sales is an example, prohibiting alcohol use and sales at sporting events, limiting the number and density of alcohol establishments, so limiting the number of outlets that are in a certain area, as well as responsible beverage service training laws. So, and that could be a law or it could be a policy that requires people to be trained if they are serving alcoholic beverages. So these are just some examples of how we can address availability and access. But the truth is, a lot of these things are done through policy work. And that's another arm of environmental prevention, is implementing clear and consistent rules that address the sale, possession, and use of alcohol and other drugs. And we can have the greatest policies in the world, but if they're not being enforced, they don't matter. So I think that really underscores the importance of a strong partnership with our law enforcement and campus administration, both the law enforcement entity or campus safety entity on your in your community, because it's really important that we have really strong policies. It's just as important that those strong policies are being enforced. So what are some of those policies? Well, I had mentioned earlier increasing the cost of alcohol, and that can be done through increasing an alcohol tax. Social host and nuisance party ordinances are community ordinances that can reduce the number of that might be happening in your community. Zoning ordinances are also an option as a means for reducing outlet density. And campuses might be able to create their own policies and practices around substance-free housing, alternative to use events, registering parties, mandatory Friday classes, or at least offering Friday classes, as well as parental notification if a student has a code of conduct violation that is alcohol or drug related. So an example of the policy piece, a great case study for that is the Maryland alcohol tax. So in 2011, they actually raised their state alcohol excess tax from 6% to 9%, and during that time, they saw a reduction in overall alcohol sales by 4%. But one of the things that I think is really interesting and also helps reinforce the idea that we can't work in silos when we address this issue, because the issues that high-risk alcohol use can come from high-risk alcohol use, can permeate in so many different areas, is they also saw a 24% reduction in gonorrhea rates that they have attributed to the tax. Because they raised alcohol taxes, not only did they see a reduction in overall alcohol sales, but they also saw a reduction in sexually transmitted infection rates. I think the ultimate example of the benefit of environmental prevention is what environmental prevention has done for smoking. So let's take a look at that, kind of the 3 different areas: norms, availability, and policy, and what has happened, how those have been applied to smoking, and how that has impacted our smoking rate. So when we look at norms, we've seen an increase in anti-smoking campaigns, and a lot of the things that have happened in part because of that master settlement from 1998, but this has not been a fast transition. So the work around environmental prevention to reduce smoking rates started in 1964 with the release of the Surgeon General's report. So we started to see anti-smoking campaigns way back then, but there's probably some that stick out to you now. Like the Truth campaign was one that was very popular in the 2000s. We also saw a reduction in availability and access, so we limited places people could smoke. You know, back in the 70s and 80s, we started reducing, we had public bans on smoking in public places. You could no longer smoke in airplanes. And then more recently, we've seen bans on smoking in workplaces as well as bars and restaurants in states. We also limited access by removing cigarette vending machines. So that allowed and helped ensure that people who were of legal age could access cigarettes versus those who may not be of legal age. And we also made tobacco products significantly more expensive by increasing the excise tax on tobacco products. When it comes to policy, we saw the introduction and expansion of the smoke-free laws that limited availability. We saw age restriction laws, and we're even seeing those expand now. In fact, as of April, Cleveland has implemented a 21 and up age restriction on cigarettes. So now in the city limits of Cleveland, you must be 21 to purchase cigarettes. And there's been a direct correlation between increasing the age of purchasing tobacco and decreasing the rate of smoking. We've also increased taxes as well. And the Robert Wood Johnson Foundation has some really neat information about kind of the progress that we've made when it comes to smoking. So if anyone is really interested in that, I encourage you to check it out. And that's where I got this graph from. But you can see with the introduction of the Surgeon General's report in 1964, the work that has been done along the way, we've seen a huge decrease in the number of people, a number of adults that are smoking. So how do we know what is effective and what works for us? Because you know, I think that's one of the other challenges is we might know of all of these strategies that can work, but you know, I'm only one person. I have very limited resources. What are some tools that can help me identify what would be the best strategy to implement? Understanding the efforts that we need to make. And the College AIM document is one that can help guide those decisions. So those of you who have been attending OCI events over the year, you know we've been talking about the College AIM a lot, but it really is an excellent document and a great resource, and is included in that resource folder in Dropbox if you don't already have a copy. But just to give you a little history of kind of why it's so important and such a landmark document, in 2002, the call to action was released, and that was the first kind of official call to addressing high-risk drinking in college settings that there had been. And so now it's 2016, and we really needed some additional guidance. The call to action gave us the 4 tiers of effectiveness and outlined what strategies would be considered most effective with college students, what strategies are not effective at all. And since 2002, there's been a lot of research around effective prevention at the individual level and at the environmental level, and so an update was really necessary. And so the College AIM is an update to this call to action, which was really revolutionary and helped kind of move things forward with environmental prevention in the beginning in 2002. So when we take a look at the College AIM, what makes it really great is it already has done a lot of evaluation work for you. So once you understand what your need is and your resources, you can use it to identify what the best strategy would be. So the College AIM looks at the effectiveness of an intervention, the barriers to that intervention, how costly it is, what the reach would be. But it also looks at how much research there is, what kind of delivery method is it, do we need special staff for it, and who is our target population. So this is just a page that I've taken directly from the college AIM around environmental. See, it's in a grid form, and at the very top on the upper left-hand corner, we see the environmental strategies that have the lowest cost and the highest effectiveness. And if you take a look at the pages of environmental level strategies side by side with the page with the individual level strategies, you'll be able to notice that environmental level strategies are more on that left-hand side of the grid. They're lower cost strategies. Some of them take a little bit more time and resources to implement in terms of manpower, but they don't have a lot of cost associated with them. And they make the biggest, it's the biggest bang for your buck in the sense that you have the ability then to take this strategy that has a lower cost and can have the potential to impact the most number of people. So the PDF document is in the Dropbox folder that you'll receive after the webinar, but there is a website as well. If you go to collegedrinkingprevention.gov, you'll be able to link to the college AIM from that site. And the website is actually really dynamic and a great opportunity to take a look at the strategies a little bit more in depth than what the PDF document is. And so here's another page from the website. And so we're going to take a look at restricting happy hours and price promotions. So if you click on that, this is the page that you're going to see. And so we see all of those evaluation criteria that I talked about below. We see that it is high effectiveness, low cost, and happy hours are something that in the Ohio Revised Code, there are restrictions for happy hours. And so although it might be challenging to restrict those further within your community, not necessarily impossible, but maybe challenging, what might be easier is the enforcement of current law around happy hour promotion. And if you take a read through the law that is there, and I've included that in the Dropbox folder as well, and take a look at your campus and some of the advertisements that the bars around your campus are advertising around happy hours, you may find that there are a few that aren't necessarily in compliance with those laws. So that might be an option for something to take a look at is, are the bars and alcohol retail establishments actually in compliance when it comes to price promotions and happy hours? One of the other best things about the college AIM is that all the research that they evaluated for each individual strategy is listed there, and if possible, it's linked to. So you have the ability to go in and see what kind of research there is. And I think there's a lot of value to that, especially if you're working with those who may not have the prevention background that you do, to be able to help people understand why something is effective and why it might be a great strategy. So the college AIM is a great resource all around when it comes to prevention strategies for alcohol at the college level. It can help us identify strategies, but we also have to understand what our limitations are. And so some of the strategies that we've talked about, you may be thinking, well, you know, that's really great, but I'm just working on my campus, maybe working with my community, and there isn't much I can do for increasing the alcohol tax within our entire state. And there may be some truth to that, and so it's important to understand what we can do within our campus and community. And although there are some environmental strategies that happen at the state level, there are quite a few that we can implement at our campus level as well as within our community. And so this chart just kind of outlines what some of those are. So within our community, we can work on restricting alcohol retail outlet density through zoning ordinances. We have the ability to restrict happy hours or price promotions within the community, as well as on your campus if your campus is serving alcohol. So your campus can create its own policy around what it will their alcohol establishments in terms of price promotions. We can work on enforcing the legal drinking age by expanding compliance checks within our campus and community alcohol establishments, preventing the use of false identification. We can work on enacting responsible beverage service training with our campus and community alcohol establishments, and prohibiting alcohol use and sales at campus sporting events. But I think it's important to remember that teamwork makes the dream work, and so it's important that we aren't doing this work in a silo just on our campus. Although there are some things that may be campus-specific around environmental strategies that we certainly want to address, we need to be working with our community partners or engaging our community partners. When we talk about changing the environment, remember that the campus is only part of a student's environment, even those that are living on campus. So all students find their way into the community, and when we are trying to change, short-sighted to only think of the community. And we're going to kind of dive into that a little bit deeper next time at our upcoming webinar. So let's talk about a few next steps, things that we can do now that we have kind of a basic understanding of environmental prevention. So one of the things that you can do if you haven't done already is take a look at what your environment looks like. So what are students seeing when it comes to alcohol and other drugs? And what kind of policies do you have that are alcohol or drug related? Those of you who maybe have a really active campus and community coalition, maybe you've already done an environmental scan for alcohol, but have you done an environmental scan for tobacco? Because the environment with tobacco and vaping pens is changing all the time, so that might be another place to go. And we actually have included a scanning tool that you can use in that Dropbox folder that was created by the former Higher Education Center as a starting point for getting an idea of what students are seeing when it comes to alcohol promotion and sales. So the scan is really important to be able to determine where we need to go, and we need to have a good understanding of the problem to be able to help us find a solution within it. One of the benefits of environmental prevention is that you don't have to have any special training or education. You don't have to be licensed or credentialed to be able to do environmental prevention the way you may need to do certain kinds of individual strategies and working with students one-on-one. And so now is a really excellent time to engage our community allies and use students to help do some of our work. And so students are an excellent people to rely on when it comes to this scanning tool, because they're the ones that we're focusing on. So getting them to take a look at their campus and their community and note what they're seeing when it comes to alcohol can really be valuable to the work that you're doing on your campus and your community, and kind of set a foundation for where we need to go next. So that's kind of the end of our of what we have today. So if you have questions, I encourage you to send those in. But we do want to talk about where we're going next, because we have our next webinar in our series, Putting the Puzzle Pieces Together, which is going to take this webinar kind of a step further in terms of, so we have identified maybe our issue. What are our next steps in terms of planning prevention strategies to implement on our campus and work with our community to address? And that'll be October 22nd at 2 o'clock, and we'll be sending information to register for that out shortly. But we also want to remind you about the Solutions Summit that is coming up November 2nd from 9:30 to 4 at the Embassy Suites in Columbus Airport. Registration will be $20, and you'll be seeing the registration for that early next week. So we hope that you'll be able to attend that in partnership with community professionals. I think ideally you would have a campus and community team that attend. We're really excited about the program that we have. We have Dr. Steve Gavazzi, who is a dean at Ohio State University Mansfield, who has done a lot of work with town-gown relationships and has seen how alcohol is a common thread through all of it. And with that, if you have any questions, we'd love to answer them.
Thank you, Cindy. We did have one question, and it's about the sort of timeline that community campuses might expect to do if they're looking at doing sort of a scan in their community. How much time is reasonable to spend on that? And in using the tools, you mentioned the students, but what other key partners might be good to bring into that process?
That's a great question. So when it comes to physically doing a scan, there isn't a lot of time involved with doing that, and so that makes it kind of an easy first step, and can also give your campus and community partners an opportunity to really see what students are seeing, because if they're not seeing it from that student perspective, if they look at the community from a different perspective potentially than students do. And so I think there's a lot of value to engaging students in that process. In terms of partners, making sure that your campus is well represented as well as your community is important. So our community leadership, if it's possible to get our mayor and city council members involved. I think one group that is often forgotten when it comes to this kind of work is engaging our business owners, and if we can engage our bar owners in this work, you know, they have a unique perspective that can really help move the work forward at a faster pace if we can get our bar owners on board. Law enforcement is an integral partner when it comes to environmental prevention, and so having them on board from the campus and community perspective is really important as well. I urge you to join us for our next webinar, because we're really going to dive a little bit deeper in terms of capacity and who should be at the table when we are talking about campus and community partnerships and moving environmental strategies forward.
Thank you, Cindy. And at this time, we don't have a great number of questions that are still rolling in. You kind of tackled a couple there with your explanation. So all, please understand, you may still submit questions, and we will certainly incorporate them in any sort of follow-up documents, and you would be happy to do so. Please watch for the follow-up email, and if you have any troubles accessing anything, or if you have a difficult time accessing our YouTube link that will come out, please do not hesitate to let us know. We thank you for your time and hope you have a wonderful day.
Thank you, everyone. We look forward to seeing you in October.